call this hearing to order. Good morning, everyone. The committee will come to order. Thank you to everyone joining us today for this important discussion. As co-chair of the House Democratic Steering and Policy Committee, I'm proud to open our 17th event this Congress focused on issues most important to Americans. Throughout the year, this committee has traveled across the country and convened hearings on the issues Americans care about: the rising cost of health care, threats to Medicaid and SNAP, the squeeze on small businesses, and the persistent challenges facing seniors, veterans, and workers. Everywhere we've been, we've heard one message again and again: the cost of living is out of control, and Republican policies are making it worse. Today's hearing continues that work by focusing on what families are experiencing in Trump's unaffordable America, an America where costs keep rising, straining budgets of working Americans. The recent Republican shutdown amplified those pressures, disrupting healthcare services, delaying SNAP, and spreading uncertainty to households already stretched thin. Families today are navigating a landscape where the essentials, healthcare, housing, utilities, childcare, groceries, all cost more. But instead of offering solutions, the Trump administration has issued funding freezes, is forcing Americans to pay more due to tariffs, and is more focused on stabilizing the Argentinian economy than our own. Across the country, parents are weighing whether they can keep their lights on or refill a prescription. Workers are facing skyrocketing health care premiums. Families caring for loved ones are bracing for premium spikes, and millions of households are falling deeper into debt simply because utility costs keep rising and wages stagnate. House Republicans believe in a different path, one where families have room to breathe. We believe in strengthening the Affordable Care Act, not sabotaging it. We believe that utility costs should be fair and transparent, and that families should never be pushed into debt for heat, electricity, or water. And we believe that no American should have to choose between economic survival and basic dignity. Today's hearing is an opportunity to center the people behind these policy debates and to underscore why lowering costs is not just good economics, it's a moral imperative. I'm grateful to my colleagues for their dedication to this work, and I look forward to the conversation ahead. Now, I will introduce, and thank you to my colleagues for being here. I will introduce our first witness. Nicole Sheep is a mother of 4 children who experience various mental health, learning, and developmental disabilities, a trained occupational therapist. She is unable to work outside the home due to the demands of full-time caregiving. Her husband, a self-employed architectural engineer, works constantly to keep up the rising costs, while the families rely on Medicaid for their children's health care coverage and on the Affordable Care Act for their parents' coverage. Recently, Nicole learned that her ACA premium will increase from $75 to $550 per month next year, forcing the family to consider fuel assistance and even cutting back on groceries just to afford insurance. Nicole, I'm going to turn it over to you to tell you have 5 minutes to tell your story.
Thank you very much. I appreciate the chance to share how our nation's affordability crisis is impacting families like mine. My name is Nicole Sheaf, and I am a proud member of Moms Rising. I'm an Exeter, New Hampshire resident, and as you stated before, I'm also an occupational therapist. My 4 children, ages 24, 21, 17, and 12, have various levels of disability, including mental health and developmental disability. The rising cost of housing, groceries, utilities, and other essentials has forced my family to stretch every dollar to make it through each month. And the looming costs of Medicaid and the Affordable Care Act threaten to send us off a financial cliff. Raising 4 children with disabilities has never been easy, especially in a country that has failed to adequately invest in care. I'm an occupational therapist, as you had mentioned, but for many years I have not been able to take a paid job because I spend my entire time project managing and caring for my children's needs. Between coordinating their care teams, getting them to appointments, supporting them in meeting their day-to-day challenges, and managing my children's care is a full-time job and just happens to be unpaid. In today's economy, trying to make it with just one income feels impossible, and my husband, who is self-employed as an architectural engineer, needs to work 24/7 to make things meet for the cost, from everything from heat to fresh produce, because it has soared. He's taken on more and more projects so we can keep up. And it's still not enough. My family stares down the healthcare crisis that our country is facing. The Medicaid and Affordable Care Act are lifelines for our family. My husband is self-employed. That is his only option for health care. My kids qualify for Medicaid because of their disabilities, and they make a point really clear that Medicaid is their only option for long-term care for what they need throughout their lives, and to take care of their chronic healthcare conditions. So when the latest budget bill slashed $1 trillion from Medicaid, I felt like my 23 years of work advocating for my children was null and void. We've already struggled with long wait lists, limited providers, and shortages of in-home providers based on Medicaid reimbursement rates because they're so low. I'm terrified that these cuts will make those challenges much worse. When I left my job 6 years ago during COVID, my husband and I qualified for Medicaid due to the pandemic-related expansions. When those ended, we were able to sign up for the Affordable Care Act insurance plan, and that was actually affordable, thanks to the enhanced premium tax credits. Our ACA plan has generally cost us about $75 to $125 a month for my husband and I. When I first read about the tax credits expiring, I estimated that it might triple. And then I received a letter in the mail informing us that it's actually quintupling to $550 a month starting in January. I have absolutely no idea how we'll pay for that on a fixed income. It already feels like we're robbing Peter to pay Paul. We're looking at applying for assistance with utilities so we can eventually offset the increase for health insurance. I'm terrified that we won't be able to keep up with our mortgage. At the same time, going without health insurance is not an option. My husband has a chronic health care condition that needs medication to manage, and he would not be able to afford that without the coverage that we currently have. He's lost family members in his past to the same condition, and we simply cannot take that risk, but he's our sole income. We are counting on lawmakers to recognize the challenges working families are facing and treat this like the emergency it is. I worry that cuts to Medicaid and the ACA premium tax credits will increase costs by forcing people to rely on ER, the emergency room visits for health care. And I worry this crisis will force people with health challenges out of the workforce like it did for me. And then they cannot get the care that they need. This affects all of us in one way or another. And I'm extremely disappointed that Congress has not solved our healthcare crisis. January 1st is coming up fast, and we need to take action now. I really appreciate everything the House Democrats are doing to fight lowering the cost of healthcare, groceries, housing, utilities, and other essentials. Thank you very much.
Good morning. Thank you to Leader Jeffries and Steering and Policy Co-Chairs Barragan, Wasserman, Schultz, and Kelly for convening this hearing to highlight the work House Democrats are doing to hold the Trump administration and House Republicans accountable for breaking the promises they have made to improve affordability and protect access to health care. President Trump came into office pledging to lower costs for Americans, from groceries to utility costs to health care, on day one of his administration, and he has failed. He has cut over $1 trillion in healthcare spending, undermining programs like Medicaid, and now with the cooperation of House Republicans, is going to allow Affordable Care Act tax credits to expire, causing healthcare costs to skyrocket for millions of Americans. These reckless cuts and irresponsible actions have a devastating impact on people in all of our states and in all of our communities. Adding insult to injury, the president is focused not on these affordability challenges, but on his new $400 million ballroom. We have here with us today a New Jersey leader who is going to talk about how Trump and House Republicans' failure to extend ACA tax credits is hurting him and his family. I'm proud to introduce Thomas Mumji. Thomas is a dedicated adjunct lecturer at Rutgers University and a member of the Rutgers AAUP-AFT union who depends on the ACA to access healthcare and who understands firsthand the consequences that will occur when Trump and House Republicans allow ACA tax credits to expire in 10 legislative days. Thomas, we're honored to have you here today, and the floor is yours.
Really do have to push that hard. Thank you for having me this morning. Good morning. My name is Thomas Mumji. As said, I'm an adjunct lecturer at Rutgers University in New Brunswick, New Jersey. I'm here to talk about the cost of healthcare and the hard economic choices that Americans are facing right now if we allow the Affordable Care Act credits to expire in the next few weeks. Most Americans live in fear of being one medical crisis away from a financial crisis, if not financial ruin. In the winter of 2019, I was hospitalized for close to 48 hours after collapsing with walking pneumonia. The cost of after 2 days in the hospital, including the ambulance ride, which is a $1,000 hospital ride for 7 blocks. I live 7 blocks from the hospital. Emergency room, medical imaging, various inpatient costs was over $30,000. I didn't have insurance at the time, and the cost for a bronze plan back then was about $500 a month. This was pre-ACA tax credits. I couldn't afford that, so I took the risk, and the risk ultimately cost me the savings I'd had for a down payment on a house. The future turned into falling behind, and it's only been in the past year or so that I was starting to get back to a point where I could actually conceive of maybe getting ahead, saving some money again. That's over. I now face the STEM calculated choice that I had back in December of 2018. Do I forego insurance and see what happens if I face another medical crisis? Will I gamble on who will take care of my disabled mother if I'm incapacitated? And the answer right now is yes. I have to take that risk because the cost of $600 to $800 per month compared to the $100 that I'm paying now is just simply too much money. I had a modest increase in income this past year, talking a little more than $7,000. But I'm already looking at higher costs for food, energy. My rental payments are certainly not going down. And I can't afford the current health insurance rates that go into effect on January 1st. I have to hope that I do not have another medical crisis in 2026. That's my current health plan. That's what I'm going to do. And my story could be told by tens of millions of Americans in different ways, but with an equally maddening instance of falling through the cracks in our healthcare system. Many adjuncts like me, but this is also for people that are self-employed and working part-time, are worried since they're often ineligible for employer and sponsored insurance. A recent AFT survey found that 15% of responding adjuncts are on the ACA in my state of New Jersey. The expiration of the ACA tax credits means that the access to a crucial lifeline was going to be diminished. The entire system of health insurance is facing rising costs, and we cannot fix all of this before January 1st, but we can extend the ACA tax credits so that millions of people like me won't have to choose between health insurance and food, health insurance and housing, health insurance and taking care of your children. And if we don't extend these tax credits, the cumulative shock to the insurance system of millions of people leaving the insurance pool is only going to raise costs more. As the pool gets older and sicker, emergency rooms will see more people like me as we forgo preventative care and increase our risks. And I know it's easier to keep deferring this question of who pays just onto individual Americans in our most vulnerable moments, but we need to triage right now. Right now. So the question of who pays isn't just passed on to people like us, because when it's passed on to us, we're not going to be paying with money. We're going to be paying with our lives. Thank you for having me today.
Thank you, Madam Chair. I want to thank you and the Steering and Policy Committee for holding this important hearing today. I want to thank our witnesses for your powerful testimony. I'll be introducing Ms. Reyes in a moment. But I did want to say that I want to focus on the Head Start program briefly this morning before we have a chance to hear back from our witnesses. The Head Start program has been one of the most effective programs ever enacted in the United States to address poverty and to help people get an early start, especially kids who come from disadvantaged backgrounds. And so that's why the Trump administration's attack on the program has been so heartbreaking, I think, and counterproductive. I wanted to offer an article into our record. Head Start is turning 60. The federal child care program may not make it to 61. And some of the points that the article makes talks about the attacks by the Trump administration on the Head Start program. The first blow to the Head Start program in this administration was President Trump's January 27 executive order calling for a federal funding freeze. Now, temporary interruptions in funding can cause programs to close their doors. Many of these programs go on razor-thin margins, as we're going to hear, I think, in a moment. And so that can be very devastating to them. The next step the Trump administration took was to fire 70 Head Start staffers who were pink-slipped. That's almost 1/5 of the program's workforce. And one of those employees said, they say we're bloated. We could have used 2 more full-time people. The cuts, he said, would be devastating, not simply for him, but for kids who are in the program and need to be safe. He said this, I come from the private sector. I'll find another job. The issue isn't us, it's the children and the families. We've got all these people in poverty who are getting screwed over by what's happening. The third devastating step that the Trump administration took was the passage, in conjunction with House Republicans, was the passage of the budget resolution that cut $880 billion in discretionary spending from programs like Medicaid and SNAP, which are closely interrelated to Head Start, and help to be a total safety net for people who are in the situation where they need the Head Start program the most and benefit the most from it. And so that brings me to my witness, Carolina Reyes, who comes from my district. She does work in Laurel, Maryland. She's a proud member of the nationwide advocacy group Moms Rising and serves as the director of Arco Iris Bilingual Children's Center, a Head Start partner preschool in Laurel. And with that, I turn the floor over to you, Ms. Reyes.
Good morning. Can you guys hear me? Yeah.
Yes.
Good morning. Buenos días. My name is Carolina Reyes. I'm a proud member of My Rising. I am a mom of 2 amazing daughters, one of whom is in high school and the other one in college. I expect to earn my master's degree next spring. I'm the owner and director of Arco Iris Bilingual Children's Center, a child care program in Laurel, Maryland. We are Prince George County's first bilingual preschool and a Head Start partner. We have a capacity for 47 children, but we are serving at the moment 32 children from 2 to 5 years old. I'm proud to serve at Maryland's Governor Moore's State's Early Childhood Advisory Council. And thank you for the opportunity to share how the affordability crisis is harming the families in my community. These are incredibly tough times for young families. So many parents of children in my program work extremely hard, many at more than one job, and they still live paycheck by paycheck, relying on churches or food bank to feed or clothe their kids. These are moms and dads who are scared of what the total cost of their groceries will be and afraid they will have to put the milk or cheese back on the shelves because they don't have the money to pay for them. They are moms and dads who walk long distance to and from their jobs because they can't afford bus or metro fares. The increasing cost of food, rent, clothing, and other essentials makes life even more difficult. For some students in my program, the meal they get in childcare or Head Start may be the only meal they get that day. These families are terrified about losing their SNAP benefits or having them delayed. They are panicking about what the cuts of Medicaid will mean for their health care. Many already can't afford the medication or care they need. They are worried about heating their homes this winter and what closing the U.S. Department of Education will mean to their children. And for immigrant families, even with documentation, the ICE rates and the racial profile create even more trauma. Even being here today, I question myself if I could be targeted by ICE due to my accent and speaking Spanish and looking like a Latina. It is unbelievable that I have to fear this even for a second. If I feel this, imagine the immigrant families who are much more vulnerable. These hardworking parents depend on our childcare program, but Congress has failed to significantly invest in childcare and to stabilize the industry. So we function on the margins. Without reserves, we will need to keep classrooms open if our Head Start funding disappears. Losing access to childcare will put families in crisis. Without childcare or early learning programs, parents cannot go to work. And children won't be able to have the opportunity to be ready for kindergarten. I know this with certainty that high quality early care and education is starting at birth, is essential for our children. I know programs like mine only serve a fraction of families who need us. With the cost of childcare so high and the shortage of programs so severe, so many parents have been pushed out of the workforce, and far too many children are missing out on critical early learning opportunities. We need our elected leaders to address this crisis, but instead, this administration is sending us in the wrong direction. I am passionate about what I do because I have seen the difference quality early education can make in a child's life. At Arcoiris Bilingual Children's Center, we take pride in fostering a lifelong love of learning in our students and teaching them the skills they need to succeed in kindergarten and beyond. There are no better feeling than watching your learners gleefully gather for story time, finally mastering their ABCs, gain the confidence they need to try new things, and learn to solve conflict with their friends. When families are under stress, as so many are now, they need us more than ever. Children feel the stress, and they need the support, the community, the social and emotional learning we know how to provide. I can assure you, the affordability crisis is not a hoax. It's very real and is ever present in the lives of the nation's young families. It causes chaos and hardship. So I am incredibly grateful for leaders like you, all of you here today, who see us, who listen to us, who recognize the challenge we face, and who are working so hard to make our lives better. Thank you. Muchas gracias.
Thank you. Thank you, Carolina. Thank you. Muchísimas gracias. I see you, and we see you. Thank you for sharing your story, your fears, and those of immigrant families and children, which is unacceptable in this country. Thank you for your advocacy with Moms Rising in support of Head Start. Every child deserves a chance to thrive when they start school, and parents should not have to choose between paying for expensive childcare or missing work to take care of their young children. The cost of living is too high. Americans work just to live paycheck to paycheck. We've heard that here already. And that's because Donald Trump and Republicans have raised the cost of everything, including the cost of healthcare. Access to quality, affordable healthcare saves lives, and that is a fact. And while Trump and Republicans prioritize rewarding billionaires, Democrats are fighting to extend the healthcare tax credits that actually lower cost and prevent massive premium increases. We need just a few Republicans to put the people first and to join us, because hardworking Americans deserve better. And that's why I'm glad to introduce today our next witness, Brian Scherer, who will speak to this higher cost of living, thanks in part to rising energy and utility costs. Brian is a director of competition and regulatory policy at Vanderbilt Policy Accelerator, an academic research group that focuses on topics in political economy and regulation. A longtime advocate for corporate accountability and fair markets, Brian has held leadership roles at the Consumer Financial Protection Bureau. He led the agency's regulatory agenda, including junk fee prohibitions, privacy regulations, regulations on medical debt, and the agency's reform of fair dealing standards. He was also founder of Justice Catalyst Law, a nonprofit law firm that files class action suits related to antitrust, consumer protection, employment, and civil rights law to advance economic justice. Brian, thank you for joining us today. You are now recognized.
Thank you, Congresswoman. And thank you for giving me an opportunity to speak today. My name is Brian Scherer. I am the Director of Competition and Regulatory Policy at Vanderbilt Policy Accelerator, which is a center attached to Vanderbilt University and focused on economic policy. In the United States, we are in the middle of an affordability crisis. In the last 5 years, average prices have increased by 25%, but this is just the tip of the iceberg. For decades, the largest bills for most Americans, housing, childcare, healthcare, education, in other words, the household monthly bills, have all risen dramatically faster than inflation and faster than wages. As a result, wealth inequality has been rising for 50 years. In the past year, nearly 40% of Americans have had to turn to credit cards to pay for bills or everyday essentials. Making matters even worse, without action from Congress, 20 million Americans are set to see their health insurance premiums skyrocket at the end of this year, less than a month away. I can imagine policymakers have a keen interest in lowering costs given the recent clamor, but might feel they don't have a lot of tools to do so quickly. We often hear about policy designed to bend the cost curve or increase supply over time, but we aren't limited to those solutions everywhere. There are whole sectors of the economy where the government has, for a century, been directly setting the prices. The Vanderbilt Policy Accelerator has a program to study and revitalize the academic focus on these networks, platforms, and utilities, and energy bills is one of them, and that is going to be my focus for the rest of these remarks. In the United States, privately owned energy utilities operate as regional monopolies. Both because utilities are monopolies and because they are essential infrastructure, state governments set the price to ensure bills are fair and that utility companies don't go out of business. In addition, the federal government, through the Federal Energy Regulatory Commission, or FERC, sets the price for wholesale energy, which is an important input cost that's passed on to the bills that states approve. But despite the fact that these are prices set by the government, recent research from the Century Foundation and Protect Borrowers paints a pretty dire picture of rising energy bills across the country and how they are affecting American families. For example, in just the last 3 years, monthly energy costs have spiked 35%. That's faster than inflation. This year alone, costs have increased 12%. And that increase has actually sped up in the later half of the year. So it's getting worse. Just this year, the number of households with severely overdue utility debt, people at risk of having the lights turned off, has increased by 100,000 households. Since 2022, overdue balances on utility bills have climbed 32%. And right now, 14 million Americans, 1 in 20, are severely behind on their utility bills at threat of having the debts be referred to collection and having the power turned off. And while Americans are drowning in utility debt, utility investors are swimming in money. The government sets energy bill prices to ensure that investors can earn a reasonable return. But since 2020, they've been approving drastically inflated returns of 10%, which is the average return in the stock market. Investors are enjoying S&P 500 level returns, but without the risk of a typical stock, because these are government-protected monopolies. They're notoriously safe investments. That is one of the reasons prices are so high. For more information on that, I'd steer you to the American Economic Liberty Project's amazing work on this from just this year. In sum, energy bills are high, and this is not a market failure. It's a policy failure, because this is one of the few areas where government is actually setting these prices. If policymakers are looking for ways to cut prices for Americans, as they should be, and as we all are, they can start by making sure that the government is not setting high prices in these few places where the government is really responsible for the price. The affordability crisis is clear. Americans desperately need policymakers to take action to drastically lower costs before it's too late. Thank you for the invitation to join you today. I'm happy to answer any questions that you might have.
So much, and now it's time for member questions, and Representative Kennedy.
Very much. Thank you to all of these extraordinary individuals for being here and encouraged to share your powerful stories with us here today. I want to thank the Democratic Leadership and Steering and Policy Committee, including co-chairs Berrigan, Kelly, and Wasserman Schultz, for convening today's hearing to discuss the most pressing issue facing Americans today, the rising cost of health care. And thanks again to our witnesses, especially you, Ms. Chief. I understand you're an occupational therapist, as I am. It's great to see another OT in the house here. We know firsthand what it means to work with the most vulnerable patients, to witness miraculous recoveries, and to work within a system that's meant to help people heal. But like every other American, I'm watching that very system fall apart. Every day, patients are forced to confront the Republican healthcare crisis, staring down the crushing financial burden that's set to hit them in the months and years ahead. Whether it's the astronomical medical bills that force a patient recovering from an unexpected surgery to choose between food on the table or avoiding medical debt, a notice from your insurance company that the next year's premium will be more than doubling, or a call from your primary care physician that their facility will be closed because of the trillion-dollar cut to health care enacted by Trump and congressional Republicans this past summer. These challenges don't just affect patients. Because of the Republicans' big ugly bill, hospitals are facing unprecedented losses and being forced to cut services for the most vulnerable in our communities. And states across our country, including New York, are now left scrambling to determine where to slash services to make up for the sudden loss of federal support. And to make a bad situation worse, this administration, the Trump administration, has put forward a deeply flawed proposal that will severely restrict how graduate students can finance their education in essential healthcare fields like nursing, physical and occupational therapy, mental health services, and so many other healthcare-related professions. Another reckless decision passed by congressional Republicans that sabotages the future of healthcare in America by making it financially impossible for the next generation of healthcare workers to enter the field. This proposal intensifies an already dire workforce crisis, leaving exhausted nurses and providers even more short-staffed and burned out, and ultimately undermining patients' ability to access timely, reliable care. Thanks to congressional Republicans, our healthcare system is in crisis, flashing red and warning of the devastating consequences to come. We are not going to stop fighting to protect healthcare in this nation, and our Democratic colleagues are united for a better healthcare system in this country. We're going to continue to stand up against cruel Republican policies that destabilize our healthcare workforce, gut Medicaid and Medicare funding for for children and those with disabilities, rip away care in our hospitals and clinics in outpatient settings across this country, and that are forcing healthcare in this country to become a luxury rather than the fundamental right that it is in the richest country in the world. I'm so grateful for my colleagues for their time and their leadership. And with that, I yield back.
Thank you, Rep. I just want to remind people they have 3 minutes. So, Rep Horsford.
Thank you, Chairs Kelly, Barragan, and Wasserman Schultz from the Steering and Policy Committee and our leadership for hosting this important hearing. This week, during his recent cabinet meeting, the President of the United States attacked Democrats for talking about the high cost of living. He said, and I quote, "The word affordability is a con job by the Democrats. The word affordability is a Democratic scam." A con job, a Democratic scam? Isn't this the same guy whose campaign centered on lowering the price of eggs? The same guy who declared himself the affordability president? I cannot believe anyone has to say this, but affordability is not a con job or a Democratic scam to my constituents or to constituents anywhere around this country. And anyone who says otherwise is plain wrong and frankly lying. You know what isn't a Democratic scam, but is a direct result of Republican inaction? The looming expiration of the advanced premium tax credits. These affordability lifelines helped double enrollment in the ACA marketplaces and drove record low uninsured rates. But they are all set to expire in just a matter of days. Why? Because Republican leadership has refused to work with congressional Democrats. But we only need 4 here in the House to break from their chaos and to stand with the American people. And now marketplace enrollees are already feeling the impact. Nevadans using Nevada Health Link, my state's ACA marketplace, now face premium hikes of over 26%, well above the originally projected 17.5%. What is driving this increase? The expiration of the advanced federal premium tax credits that we have been working to champion for months. And even if we can convince some of our Republican conference to extend these tax credits, the Congressional Budget Office projects that 1.5 million more people could be uninsured in 2026 compared to an earlier extension. So if you ask me, Republican inaction is the real con job. That's the scam. Mr. Mungi and Ms. Schief, just this morning, the Kaiser Family Foundation released a poll that found that due to the rising cost of marketplace health insurance, nearly 67% of households say they would likely have to cut other household expenses. I have a group of students who are here from Jobs for American Graduates from Nevada, and I know that they're going to be talking to me about these and other issues, but what does this effect have on you and households like yours?
We live on a fixed income, and we live within our means, so we have a strict budget. And so if there's going to be more expense for health care, then that needs to come from something else. So we have to make the decision on, do we apply for more services, like applying for electric assistance, or do we cut down something else? Like my children, I try to get them into extracurricular activities. Those things will probably need to go away to be able to cover just our health care. So it has to come from somewhere, and with the expenses of groceries going up and everything going up, we have to cut, or my husband has to work more. And right now he is working from like 5 to 10 at night because he's our only source of income.
We've been joined by our illustrious leader, Hakeem Jeffries. You're next.
Good morning. Thank you, Robin. Thanks to all the members, and certainly thankful for the panel of witnesses, Thomas, Carolina, Nicole, and Brian for being here today. Thank you all. for your advocacy, and of course for sharing your stories about how the Trump administration policies are hurting everyday Americans and making it more difficult for people to make ends meet. We know that last year Donald Trump and Republicans promised that they were going to lower costs on day one. And of course, costs haven't gone down, they've gone up. This is day 319 of the Trump administration and day 336 of complete Republican control of Congress. But what have we seen so far? Not a single piece of legislation, not a single plan, not even a single meaningful idea to drive down the high cost of living. Of course, in America, costs are going up. Inflation is up. Housing costs are up. Grocery prices are up. Electricity bills are skyrocketing. America is far too expensive. There are far too many people struggling to live paycheck to paycheck, as you have illustrated in such a compelling way. Through all of the chaos and cruelty and corruption that is being inflicted on the American people by House Republicans, the American people are being hurt. And these Republicans continue to make things worse. At the start of this year, Donald Trump froze critical funding for Head Start and left families and providers under duress. 2 different federal courts forced the administration to uphold their responsibility to deliver nutritional benefits during the Trump Republican shutdown. And yet Republicans continued to try to weaponize the issue of hunger against the American people. And now the USDA is planning another effort to hold SNAP benefits hostage to states across the country. We, of course, are confronting a healthcare crisis with Republicans refusing to extend the Affordable Care Act tax credits, notwithstanding the fact that they are going to expire at the end of this month, and tens of millions of Americans are going to experience dramatically increased premiums, co-pays, and deductibles. In some instances, we know costs are going to increase on everyday Americans by $1,000 or $2,000 per month. This is all unsustainable. And yet, in this environment, the one thing that Republicans have done when they cut Medicaid in their one big ugly bill, largest cut to Medicaid in American history, cut $186 billion from nutritional assistance from the American people, literally ripping food from the mouths of children, seniors, families, and others. In that same piece of legislation, they did find the time to provide massive tax breaks to their billionaire donors and then make those tax breaks permanent, yet can't even be bothered to extend Affordable Care Act tax credits for working class Americans. They're completely and totally out of control. This majority and Republican governance has been a failure for the American people. Now, as we've repeatedly stated, Democrats are willing to find common ground with anyone, anytime, any place, as long as we're making life better for the American people, improving their quality of life, and certainly focused on driving down the high cost of living and fixing our broken healthcare system. We just need serious partners on the other side of the aisle, and they're too busy fighting each other and rewarding their billionaire donors to do something meaningful for the American people. So we're thankful for your presence, for your compelling testimony, for your advocacy on behalf of the American people, and we look forward to our continued partnership on behalf of making life better for hardworking American taxpayers. And I yield back.
Thank you, Leader. Now we'll hear from Rep. Thompson from California.
Thank you, Madam Chair, and thank you to the Policy and Steering Committee leadership for making this hearing possible. I think we should be doing these every day to draw a contrast between how hard Democrats are working for the American people and how our Republican colleagues are not. The American families feel the affordability crisis every time they check out at the grocery store, turn on their lights, pay the rent, or try and buy a home. According to the Bureau of Labor Statistics, grocery bills, electricity bills, and rent have all increased over the past year, despite what this president may claim. But these price increases will pale in comparison to what people will face when they try and renew their health insurance policies for 2026. During the government shutdown, Democrats fought to extend the premium tax credits that make health insurance more affordable for millions of Americans. Without action, families will see their premiums double or even triple in just a few short weeks. Even in the middle of the shutdown, Speaker Johnson could have called the House back into session to vote on legislation that would lower costs. Instead, he kept congressional Republicans out on vacation. It was a missed opportunity to show the country that we can come together and lower prices when it matters the most. Families deserve practical solutions that make health care, housing, groceries, health care, again, and other essentials more affordable. They deserve a leadership that takes the time to create solutions to address critical issues instead of leaving them to wait. I urge Speaker Johnson and the Republican majority to consider all the Americans they represent before costs get even higher. It's time to shift a little attention away from their billionaire donors and focus on everyday working Americans who are paying too damn much every time they turn around. Mr. Momji, you mentioned that your ACA premiums are jumping from $100 to $800 in the next few weeks. You're taking care of your mom. You're trying to buy a home and provide for your own family. Have you done the back of the envelope calculation? How is this going to affect you and your effort to realize the American dream?
The dream is deferred at the moment. And to your point about the focus on a certain class of folks, billionaires. This is a ridiculous story, but I think this illustrates this well. I was on AmeriHealth a couple of years ago. It's my insurance company. And out of the blue, I got a check for $18 from AmeriHealth. And the reason that they sent me the check was because they were found to have spent too much money on advertising and administration as opposed to actual medical care. I mean, it's almost funny. Almost. So when I think about the dream deferred for that, there's no getting ahead. I mean, it's back to where we were pre-pandemic.
Thank you. Thank you all for being here today.
I know. Representative Morrison.
Thank you, Madam Chair, and thanks to the Steering and Policy Committee leadership for convening us today, and thanks so much to the witnesses for sharing your stories. We're less than 2 weeks from the deadline to enroll in ACA plans without a lapse in coverage. Thanks to the Republican-created healthcare crisis, instead of discussing holiday plans or Christmas wish lists, most families will be around kitchen tables deciding what they'll have to sacrifice to keep their health insurance. Facing sticker shock from skyrocketing premiums, in addition to broken promises of lower energy, gas, and grocery prices, Trump and Republicans in Congress are once again failing to prioritize the needs of working-class Americans. For months, they've deployed a variety of excuses. First, they tried denying premium spikes. Then they misdirected to scapegoat immigrants. Then they turned to their old and tired call to repeal and replace the ACA, which, as usual, came with hollow promises of some secret plan. They insisted they just needed the government to open, and now that it's open, it seems they're circling back to their concepts of a plan and denial. Whether or not the excuse of the week allows them to acknowledge the crisis, Republicans in Congress have made it abundantly clear that they are not willing to help Americans afford health care or do anything to help lower the cost of living. For 20 years practicing as an OBGYN myself, it was my responsibility to help my patients with preventative care, to problem solve, to diagnose, and to formulate a treatment plan with them. Can you imagine if your doctor kept making excuses for why they couldn't treat you, or worse, just fully denied your experience and refused to offer you anything? That's exactly how Trump and the Republican majority have responded to the American people's repeated pleas to act on affordability. I know that the people of Minnesota's 3rd District, my district, and Americans across the country are counting on action and deserve real solutions. Unfortunately, we're here today to discuss the devastating impact of what Trump and congressional Republicans' denial and inaction means for American families. So for you, Ms. Schief, as an occupational therapist, and I have to just personally thank you because my children have benefited greatly, life-changing occupational therapy. So thank you for your incredibly important work. You understand the complexity of care that patients have. Without health coverage, what trade-offs would a family be forced to make? And then what impact would important services like occupational and speech therapy or access to a home health aide mean if they had to go by the wayside?
Experienced this with my family, and when I had private insurance, my children's diagnoses would actually prevent our private insurance from paying for their services. So they were denied because their developmental disabilities were not acute. So the only way we were able to access speech and physical and occupational therapy was when they qualified for medical-based Medicaid. And so if we had to then ensure the co-pays and the costs of those, I don't think we would have been able to take them to therapy. We've relied a lot on school-based therapies for my children because that's all we could really afford. Unfortunately, a lot of the providers do not take Medicaid, so we're very limited, and the reimbursement rate with Medicaid also is not enough. So a lot of providers are private pay or not taking Medicaid, and so we've had to drive over an hour to get services for my children. And so it's, as I know Carolina was mentioning, like early intervention, that's where I started my career. And that is so important. And so to delay treatment and to not have access at the most vulnerable time in a person's life, it causes more challenges. And we've had to give up. What do? Do we pay for therapy? My kiddos do equine-based hippotherapy. And when they graduated from that, it needed to be adapted riding, which is out of pocket. And that's $200 a session. So it's something we cannot do. So it's affected my children's treatment. We can't find providers. We can't find staff. So that's why I quit my job, is because I do the role of the therapist, the teacher, the psychiatrist.
Thank you for sharing your story. The ripple effects of these Republican policies, if you can call them that, will devastate generations. And I'd love to ask another question, but I yield my time back as I see I've gone way over. Thank you so much.
Rep. Ruiz.
Thank you. I thank you all for being here and for giving testimony and telling your story. My heart is broken. I'm an emergency medicine physician and a public health expert, and I take care of patients. I love my patients, and I love my constituents now as a policymaker. And the human face of these policies are suffering. These policies are tremendously suffering and already. The context here is that costs are way, way, way up. The big, ugly law has taken away health care through cuts through Medicaid, taken away care through the reduction in funding for hospitals and clinics, taken away food. That's resulted in increase in costs for working people. In addition to that, Trump's tariffs has just skyrocketed costs. And then under that scenario, now they are intentionally holding back the Affordable Care Act tax credit, which will raise costs astronomically in healthcare. While they gave tax credits in the billions to billionaires, So in my district alone, costs on average would increase 254%, $18,000 a year. That's a lot. Mr. Munji, you went from 100 to 800. That's over 8 times what you were paying. And what people don't understand is what Dr. Morrison said is the ripple effects. What does that do to families? That means that you're more stressed. That means you can go into financial ruin. Going into financial ruin means depression, means domestic abuse, means divorces, means separations, means potential increase in suicides. This is real impacts, negative impacts that the American people are going to be facing. And so that's what I wanted to elucidate today. And Mr. Munji, what is this experience like for you? And also, Ms. Schiff, like in terms of your anxiety, you know, what does this mean for you? What have you been going through?
Stress of this, it compounds, you know, as you said, and it touches on everything else. And in a state like New Jersey, we've seen astronomically high increases in electrical costs for many of the reasons you were discussing. And each one of these issues, like you can't defer them all because the bills are there. So it's crippling. I mean, I've actually...
You go into financial debt, financial ruin. How about you, Ms. Schiff? What has this cost for your family?
So the whole reason my husband is self-employed is because my children were asked to leave preschool when they were 3.5, and my husband quit his job then. And I was the primary breadwinner of our family. And then 6 years ago, I developed my own mental health need and caregiver burnout, working full-time as an occupational therapist and working full-time as my children's project manager. And so really...
Was it hard?
I was not functioning.
You were not functioning?
I was not functioning.
And Mr. Mumji,
yeah.
You said you were numb? Well, we care about you. Democrats care about you, and Republicans are stripping away your health care, and we're going to fight for you.
Thank you.
Thank you. Good morning. I'm Congresswoman Hillary Skolton, represent Michigan's 3rd Congressional District, mom of 2 kids, a working mom who knows firsthand that the affordability crisis is crippling the American dream, and the leading cause of that is rising healthcare expenses. Prior to the Affordable Care Act, healthcare expenses were the leading cause of personal bankruptcy in the United States of America. We've got just 9 session days to figure this out. This is not a Republican or a Democratic issue. New polling out today says that the vast majority of the American people want us to extend these Affordable Care Act tax credits. 95% of Democrats, 84% of independents, and 72% of Republicans want these credits extended. We have to do it. We are here to work for the American people. We know that the loss of health care will devastate American families, especially those where English is a second language. Ms. Reyes, a question for you, if you would comment. You know, you've done incredible work around this. The confusion around what's going to happen in our healthcare system disproportionately affects families that don't necessarily have English as their first language. What do you see from the families that you work with, and what are some of the particular concerns that you have?
First of all, as an immigrant myself and coming to the United States and not knowing any English, is a pathway that is hard. And particularly with the current situation that the families are living, they used to go, to clinics in my state where they were able to get services for, any health issues. But once again, the language barrier is a big issue many times. And with the situation that we live in now, not having access to healthcare, not be able to feel secure to go out of the street because they don't know what can happen, is a major issue. And having the opportunity at my center to provide that space where they feel comfortable to share their worries, there is nothing that at the moment what we can do, but make sure that these people who do not have the voice that they are seen and they are heard. So I just wanted to once again say thank you to all of you for considering them as well, because they are part of the American people, and that we need to see them.
Thank you. Well, thank you for helping us to see them, for being here today, to all of you for being here and sharing your stories. Votes have been called, so I'm going to just maybe ask you each a quick question. Well, what I want to do is start with what? Oh, you are. Okay. All right. Well, I will defer to Congresswoman Barragan for her question.
Okay, thank you. I want to make sure to be able to have an opportunity to also engage. Mr. Shearer, I want to go directly to you. Americans should not be forced to go into debt just to keep the lights on. And we know this winter it's going to get cold. People need to stay warm. You mentioned the Century Foundation report in your testimony that says millions of families face utility bill debt. The Trump administration's fiscal year 26 budget proposed to eliminate funding for energy bill assistance for low-income people. There's a program called LEHOP. It provides $4 billion for heating and cooling assistance. How would cuts to this program make utility debt worse for Americans?
It's a great point. So the low-income home energy assistance program, it helps 6 million low-income Americans pay their energy bills. And, of course, your energy, having the lights on is important year-round, but in the winter, it's especially important because that's the way most people heat their homes. And so taking away that assistance at a time when you're seeing blizzards and 20-degree weather it's truly immoral and a real problem, and we could see threats to health. In addition, even if utilities don't turn the lights off, they could send your debt to collections, and then it ruins your credit, makes it harder to get a house, makes it harder to get a job, it makes it harder to get a loan, and that just further exacerbates financial precarity of people who are struggling.
And can you, in maybe 30 to 45 seconds, tell us how utility bills have actually gone up because of what the Trump administration Republicans have done to block the clean energy generation?
Sure. So it hasn't always been the case, but it is the case now that clean energy is the cheapest energy. And so when policies are discouraging clean energy and encouraging fossil fuels, what that means is they're encouraging the more expensive energy generation that's then passed on to consumers in their bills. And so it hasn't always been the case, but it is now the case that both environmental policy and affordability policy are aligned. And so that's one big problem. Another one is that when you stop a project midway, it means you wasted money on building infrastructure that still gets passed on to consumers, but is not used. And so when that happens, it's called stranded cost, and that jacks up prices. And so that's another way in which the recent policies are driving prices. And then the third thing is the tariffs. Often when tariffs are charged, only a portion of it is passed on to consumers. Because sometimes the manufacturer will absorb it. That's not the case for utilities. For utilities, because of the rate setting process, they pass 100% of their costs on to their customers. So 100% of the tariffs that utilities are experiencing are being passed on in the bills.
Thank you so much. I yield back.
Thank you, Congresswoman Barragan. My question for each of you is, we are in a world of hurt. We have held these hearings over many months because we wanted to make sure that we got a sense of how Americans are feeling and the impact of affordability. Based on the inflation we see, high cost of living, soaring health care premiums on the way, do each of you briefly think that hardworking Americans are better off today than they were a year ago? I'll start with you, Brian.
I mean, I think the data shows that credit card debt is rising, the prices are rising, And I think people are struggling more now than they were last year.
Thank you. Carolina?
The same answer. I mean, working with families, majority immigrant families, I can see that. I see the struggles, and particularly to them, because many of them may not have a legal status in the United States, which would make it harder for them to be able to seek opportunities to have a job. So it's getting harder. It used to be a little bit difficult, but now it's much more. Having access, being scared, be able to access to basic things like food. So it's definitely a big toll on them, and all the families in general are losing jobs. I also have families who were in the federal government. They lost jobs, needed to find another opportunities, not having access to childcare scholarships because in my state it's froze right at the moment. So like somebody else said today, it's a domino effect. It's not just healthcare, but it's everything. And in addition to that, I must add that the social and emotional foundation and the issues that our children are facing at the moment is horrible. We need to come together to figure it out something. I just want to say I grew up my childhood in a dictatorship in Chile. And I saw how hard it is. And then coming to America, and like somebody said, one of the richest country in the world, and we are facing this at the moment, this is unbelievable. So we need to somehow come together as a nation, of a diverse nation of many people of colors and languages, and to figure something out for all of us.
Absolutely. So well said. Thank you. Thomas?
Worse now than they were a year ago. And I worry what 6 months from now looks like. That's very scary.
Yeah, that's chilling. Nicole?
I have adult children that most likely will not leave my house anytime soon because the care that they provide. And the last time I went grocery shopping was a $400 bill. And that is by looking at generics, and that's looking at the least expensive options. In New Hampshire, we fund all our schools through property taxes, and our property taxes are about $11,000 a year. So just to have basic needs of shelter and food and all those things, that's our priority. I have electric heat in the middle of winter in New Hampshire. It can go up to $900 a month. So adding this increase of healthcare, it's going to be pulling things from our basic needs.
I mean, just listening to the impact of the skyrocketing costs that have occurred on the watch of this president just gives me chills. I spend time in New Hampshire. I know what those winters are like. And yeah, I can imagine you had a $900 heating bill. It's just mind-blowing. Thank you all for taking the time to join us today and share your stories and the impact of the impact of the skyrocketing healthcare costs and lack of affordability on so many of the people that you work on and work with, and on yourselves. On behalf of my co-chairs and myself and our leadership in the House Democratic Caucus, we really appreciate you joining us. A year ago, Republicans promised to tackle rising prices, but they've only gone up, with not a single bill brought to the House floor to meaningfully confront rising costs. Instead, they gutted Medicaid and food assistance, while Trump's tariffs made prices even higher. And yet Republicans still managed to be sure that billionaires got huge tax breaks. That was a priority. Not surprisingly, after a decade, we're still waiting for a Republican health care plan, as more than 4 million Americans face losing coverage, with millions more about to see their premiums soar in just a few weeks. We heard every day during the Republican government shutdown that they were ready to negotiate on the Affordable Care Act subsidies. But now that their months-long paid vacation is over, they are still refusing to act, still refusing to come to the table. This couldn't be more urgent. Americans face exploding premiums at a time that they're already confronting cost of living increases that we heard about today on food, groceries, housing, utilities. Yet just yesterday, Senator Moreno of Ohio said in the Oval Office that the affordability issue was a Democratic hoax. Trump calls affordability concerns a scam. I think you've helped us make it clear today that affordability and the lack of it is very real for
millions of people. The cost of living crisis and people's exploding premiums are very real. And there's something that we can fix. We can come together and address this. Instead, though, congressional Republicans just rubber stamp Trump's high tariff tax and tax breaks for billionaires agenda. It's well past time for Republicans in Congress to act. And as always, Democrats remain ready to work with anyone at any time to lower costs and protect working families. Thank you all so much for being here. With that, the Steering and Policy Committee is adjourned.
There is nobody in the room who's a better gift giver than me. But you know, there's no gatekeeping around here. I'm telling you right now. For anybody that needs some extra love during the holiday, check out the Google Holiday 100 to unwrap the holidays with this year's top trending gifts.
Welcome to our annual Google Public Sector Summit.
Gemini for Government. It's a new product we built that brings Google AI to the hands of all your people.
It's a pivotal moment for government to transform like never before.
I am so excited to show you the front door for AI for your mission.
Don't wait for the perfect moment. The opportunity is now. You have the chance to lead now. Let's do it together.
One of the most exciting steps in searching for a home is when you go from browsing online to connecting with a home listing agent. That's why Homes.com connects you directly with the home listing agent who knows the most about the home and surrounding area. Click here and boom, you're connecting directly with a home listing agent. Homes.com has the home search you've been searching for.